Now, ladies and gentlemen, our session sponsor, the entire session 3, which is being held in Hall 1, Digital Health and MedTech, is brought to you by our sponsor, Health and MedTech. So thank you to our partner. Now, our next session, Fireside Chat, is a fireside chat on the theme of reimagining health after COVID-19. What does the future hold? And ladies and gentlemen, I would like to tell you that another power-packed panel, in fact, all 3 ladies, very powerful in their own right. Ms. Karine Bachongy, lead Global Social Infrastructure IFC, is going to be facilitating the discussion with our experts. Let's take a moment to introduce her briefly. And thereafter, I will be introducing Ms. Ireena Vittal, advisor, business building expert, Indian agriculture and urban change, as also Ms. Suneeta Reddy, MD, Apollo Hospitals Enterprise Limited. So let me begin by introducing very briefly Ms. Karine Bachongy, who is advisor, business building, and Ms. Karine Bachongy, who's a global sector lead for social infrastructure, Triple P Health and Education at the International Finance Corporation Transaction Advisory Services. She's an accredited hospital director in France. Ms. Karine Bachongy has worked over 20 years in the fields of hospital management, investment in healthcare infrastructure, and pharmaceuticals. Very warm welcome to you, ma'am. Let me now take a moment to introduce Ms. Ireena Vittal, the advisor, business building, expert Indian agriculture and urban change, and she has significant expertise in emerging markets, Indian agriculture and urbanization, has contributed in a variety of private sector roles, most recently as partner at McKinsey & Company, where she was founding member of both the economic development and global emerging markets practices. Welcome, ma'am. Let me now, ladies and gentlemen, take the privilege of introducing Ms. Suneeta Reddy, MD, Apollo Hospitals Enterprise Limited. She's a member of the founding family. She joined the Apollo Hospitals Group in 1989, and she's spearheading the finance function and was instrumental in taking, while spearheading the finance function, she was instrumental in taking the organization to the international equity markets through a successful GDR and subsequently bringing the first foreign direct investment into healthcare in India. And it has been a deep domain knowledge and foresight that has guided Apollo's emergence. Thank you very much, ma'am, for joining us. And ladies and gentlemen, with that, I'm now going to hand over the proceedings to the moderator of this session, the facilitator, Ms. Karine Bachongy. Ma'am, take it away.
Thank you, Aishwarya, for the introduction. From the IFC perspective, it's a real pleasure to be NATHEALTH's technical partner for this annual summit. It's amazing to see how it works in virtual setting, to be frank. I mean, for such a large conference. Well, frankly, I have to say also that definitely I regret not to be able to interact personally with all these distinguished speakers and eminent experts. Coming to the topic of our Fireside Chat, we heard, this morning from the survey performed by IQVIA that about 60% of acute care patients delayed their treatment and then fundamentally wish to return as soon as possible to their hospital of origin, and that also chronic patients want to come physically to their medical appointment rather than through teleconsultation. So are we actually going back to old normal? The question that we would like to ask is, will this COVID pandemic fundamentally shake India's health system? Is there a pre-crisis and a post-crisis way of thinking of the health system's challenges, and how do they differ really? It might sound a bit controversial to ask the question this way, as this crisis is, of an unprecedented magnitude and put a strain on all health systems worldwide. But we allow ourselves today for this chat to take a step back, think about the after crisis, as the vaccination efforts give some hope and a bit of breathing space. So we'd like to look at it from 3 perspectives: the patient's, the provider, and the government's perspectives. And it's my pleasure to facilitate this discussion with 2 distinguished speakers who definitely have the right profile to lead us through this key visionary question. Starting with Ms. Suneeta Reddy. I mean, you hardly need to be introduced as the managing director of the Apollo's hospital group. It is the largest integrated private healthcare provider with a footprint in hospitals, but also in clinics, diagnostics, retail pharmacies, and most recently in digital healthcare. you are a key influencer. So when we all hear everywhere that our lives are going to be disrupted for good, and that a new normal will kick in post-pandemic, focusing really on the Indian health system, what do you see really changing?
Thank you, Karen. Um, I think there is going to be tremendous change. And if you heard the FM in the budget, she said that healthcare is the first pillar on which the economy is going to be built. So for the first time, I think a healthcare crisis has resulted in a financial crisis, and that's why the intense focus and the very necessary focus on healthcare. So how is it going to impact our lives? I'm Digital is something that there's been a whole session about digital, and I'm sure Ireena is going to speak about it. So I don't want to say too much, except that the first thing that we did was to launch our app during the COVID time. We had 15 million downloads on 24 by 7, the risk scoring. We were able to create a heat map and therefore decide, where, in which places we need to really serve populations that were susceptible to COVID. So this is the power of digital, that with it we're able to move closer to the consumer, and the consumer is able to move closer to the provider. It goes beyond the physical infrastructure. Having said those few lines on digital, I have to say that physical infrastructure was something that the crisis showed that we were hugely underserved by the physical infrastructure. And this, many formats of physical infrastructure, whether it's primary care where you do the detection and the diagnostics, or the secondary care where you just need to put them in a hospital bed for isolation, or the tertiary care where they needed ICU beds. So I think all over the world this impact was felt, that we just didn't have enough beds for patients, and pandemics happening in the future is something very real, and we definitely need to be prepared for this. So if you look at India and the indices, we have about 12 beds for every 10,000 people, and the WHO norm is 29 beds for 10,000. So I believe that we do need to create this infrastructure. The second thing is, if you look at Indian demographics, and this is important because you have 16% of the population which is going to be over 60 years old, and then you have 13% of the population over 45 by 2025. So this 29% of the population will be exposed to NCDs and other critical illnesses. So you definitely, for these 30% of 1.4 billion people, you need beds. I truly believe that the other 70% will go digital, will focus on preventive health care, but we can never underplay the importance of creating adequate infrastructure. And at this time, I would like to say that we also have to imagine infrastructure in new ways. So during the crisis, we used hotel rooms. We converted hotel rooms into for primary care, for isolation. So I think the importance of looking at what is the need. Is it critical? Is it tertiary, primary, secondary care? And then create appropriate infrastructure, and then be flexible about how you use the infrastructure. I think that's the second point. The third point, that formats of care are very, very important. Spending on healthcare has changed dramatically post the pandemic. So, about 24 months ago, we were at 2.4% of GDP. Currently, we're about 4% of GDP is spent on healthcare, and this in spite of the fact that the government has allocated in this budget 60,000 crores towards healthcare. This brings me to the next point, which ties in with what the government has done, which is create an insurance product called Ayushman Bharat, at an attempt to move towards universal coverage. But still, if you look at Ayushman Bharat, there were 13,000 crore episodes, or 13,000 crores that were given for payments for treating Ayushman Bharat patients, and there were about 1 crore admissions for Ayushman Bharat. So 13,000 rupees per patient is the expenditure that comes from Ayushman Bharat. I truly believe that there's an opportunity for private health insurance to really grow. It is growing at 36%, but this is just not enough. I think they are 30% of India earns a salary of over 6 lakhs rupees per annum, and these people can surely afford to buy a health insurance policy. I'm just moving on to the next topic because I think it's really important. There were many lessons learned during the pandemic. We became Atmanirbhar in a certain way, in the sense that we started manufacturing medical devices. We went into PPEs, masks. We even did ventilators. There were motor companies that were shifting their capacities to create ventilators, and we started exporting this. But I think the primary learning from this is that we need to live in a collaborative world, because if not for the collaboration of institutes from around the world, we would not have come out with the clinical protocols that we needed to look after patients. So if you think of remdesivir, it was a US protocol that came to India, and if we shut our minds and said this is not if when the day we stop learning, it become takes longer and longer, and ultimately I think whether it's the patient or the consumer, they all suffer. And this is not just about remdesivir and cure protocols, but it's also about the vaccine. There was the Vaccine Alliance was created, and there was so much research that flowed into different countries and allowed us to manufacture vaccines. And this actually made the journey so short. I mean, when have you heard of a pandemic of this sort in which a vaccine was developed in 1 year? So that I think is the big learning for us, that we need to, while we strengthen our home territory, we need to collaborate with the rest of the world to make sure that the consumer or the patient is well served.
Thank you very much for drawing the picture of a future world collaborating intensively in knowledge. I cannot agree more. Thank you very much. Ireena, Vittal, you're an independent advisor on business building and director on the boards of some of India's best known organizations and expert in urban plan and agri markets. Warm welcome. In the session today on digital health, we heard that many digital solutions were developed to serve individual patient needs, but also that there are still many roadblocks on the way. How do you see the needs of Indian patients evolving post-crisis? Do you believe that these needs can be adequately addressed with the current setup, on the one hand through publicly delivered services, and on the other hand through privately delivered services?
Thanks, Karine, for inviting me. I think the answer is it depends on which India you are talking about. There are three very different Indias as far as healthcare is concerned. And what's been fascinating to see is that COVID has perhaps accelerated what the richest part of India does, which is, to my mind, the unbundling of the hospital. These Indians, many of who, by the way, used to go to Houston or Singapore or London, have stayed in India to get some basic work done. But more importantly, they are starting to think of a continuum of care. They're starting to think of different ways of getting access to healthcare, including at home, obviously over their mobile phones. It could be in a place that's close to them, because a lot of them don't walk into a hospital, and then only walking into the hospital when they have to. So to me, one India, habits of this rich India have changed because COVID has accelerated digitization and therefore the unbundling of the hospital. I think the second India, which is middle class India, is hoping that digital access will democratize access. If you are ever a patient in India, one of the things to do is to get an appointment with a doctor that your cousin tells you is the best doctor in that particular area. And what digital has done for them is it has perhaps democratized access to some extent. What it hasn't done for them is it still hasn't given them comfort that there is a single health professional who understands their health needs on a 360 basis. This the missing GP, if you will. And so they're about racing from one test to another, from one hospital to another, continues unabated. The implication of this on both anxiety and impact on their wallet continues unabated. But at least they hope that video consult and digital will give them some amount of access. And then there is, of course, the mass of India, where Ayushman Bharat, as Suneeta said, is a new entry and has been for the last couple of years. And it helps, but it helps only in the case, as you know, of surgeries. And so in a post-pandemic India, where at best our GDP growth rate average between last year and this year will be 3%, and given the amount of time it's going to take us to build back the economy, I think we're going to see a lot more stress on spend on healthcare. And so COVID has worsened their lives as far as them being patients is, because cost of healthcare and access to healthcare continues to remain a challenge for them. So I think we're going to see different parts of India, from a patient point of view, evolving in very different gears.
Thank you, Ireena. I mean, I like very much the picture of the three Indias and with different patient needs. I think that resonates very much with the way I basically I would picture this. Suneeta, I'm just thinking about these different patient needs and the way they evolve with the crisis and the way they will, as you described, further evolve post-crisis. How is the Apollo Hospitals Group responding to this transformation?
So, like I said earlier, a lot of what we did was in the digital space because, like we recognized, they were patients who were looking for care who couldn't come to the hospital. But we recognize this as a future trend, and so we launched 24 by 7. And when we did this, during the COVID period, our teleconsultations grew by 3 times just in this 1 year, and pharmacy online utilization grew by 2.5 times. This is just an indication of the trend that we will see in the future. But in the past, we've also done teleconsults. We've worked for state governments, we've set up teleclinics, and we've had the experience of doing over 700,000 teleconsults. In the process, we've onboarded 6,000 doctors. So we must also think of, the doctor's role in this. So I truly believe that, doctors who are hesitant to come into their practices and who are looking at improving their productivity, surely, telemedicine is an app that they will definitely want to be part of. It is also a revenue stream for them, for both the provider and for the doctor, the consultant. And for the patient, of course, it's all about access. So for us, it's really taking the value proposition closer to the consumer. And one part of it is being digital, whether it's about, teleconsults or pharmacy delivery or being your healthcare companion. So we have chronic care management, for example, diabetes, and much of this can be done over your phone. It can be done through telemedicine because the clinical care protocols allow this. The second part of what we did is to make sure that our home care was something that we really stepped up on. We did about 24,000 episodes of looking after people at home. Part of this was digital and monitored by just a doctor and nurse. But the rest of it was really, at some occasions we set up ICUs at home. So yes, care is definitely moving closer to the consumer. And at Apollo, we've recognized that this shift is going to happen. And so is diagnostics. I mean, we've seen the number of tests that have been done. We did 250,000 tests, but if you look at all the other diagnostic companies, the volumes have grown tremendously. And people are really not coming into physical sites, they're getting it done at home. So I think all of this is about how we move, how we think of what the consumer wants, the convenience of the consumer, and how we deliver value to the consumer. So as we do, but overlaid on top of this, and especially for a company like ours, is how do we think about what is sustainable? So if you look at the market today, and this is really something that I heard even in the previous segment, people are talking about investing into new companies in digital health, and these companies attract huge capital. And people talk about the number of people, it's either volumes or it's the number of people that you see for maybe 1 minute or 2 minutes. But more importantly, beyond valuations, I want people to start thinking about the sustainability of cash flows, because that's really what drives us. And as we launch 24/7, we are moving closer to the consumer, but we're also creating a sustainable business proposition where the physical infrastructure is overlaid with the digital infrastructure.
Thank you very much. And this is very inspiring to see so many models now being implemented and enabling to basically increase the reach of healthcare services. And we hope also that this reach will touch upon more remote areas, which is of course where the deficit in infrastructure and services is the greatest. If I may, Suneeta, ask a follow-up question. We've heard, many times today, discussion around, the deficit of trust between public and private sectors, and the importance of reinforcing collaboration. Now, in many ways, government and public authorities and the private sector have worked in tandem to address the crisis. For example, to scale up testing, COVID testing, in some areas to also treat patients, and now for vaccination deployment. So this is important to see this and to state, that this is taking place. But do you think that these successful experience are now going to set the stage for more systematic public-private partnerships? I mean, is now really the time to tackle these remaining obstacles that we heard about today and go for tighter partnerships for infrastructure, for service delivery, for human resources, for information systems?
Yes, this is probably the best time to do that. And, with regard to trust, I think that, we worked with 13 state governments. Ireena said that India has many Indias, but it's also in terms of geography, working with health is a state subject. So, we really had to work with 13 separate governments while treating COVID patients, while giving uniform clinical protocols across states. So we do hope that this is an opportunity for us to work with governments. And the areas that are most vital are infrastructure, because if you look at the typical project cost of a hospital that we need to set up today, 60% of the project cost comes from just land alone. Earlier, when we started the first Apollo, it was about 25%. So this has dramatically changed the cost structure. And I think people don't understand this. So they talk about profiteering without recognizing that the costs have gone up. And this is, if you look at the balance sheet, it's not only the asset cost but the operating cost. We are woefully lacking in skilled manpower, and especially doctors and surgeons. So many of our surgeons we actually brought from the UK and the US, and they had to have some parity with the earnings that they were getting abroad. So it's a cost of manpower, it's a cost of infrastructure, and if you look at a parallel industry, I believe 20 years ago the IT industry got these benefits. They got land allocation, they had a 15-year tax holiday, and look at where they are. They are probably, at 30% of GDP. They're highly profitable, and they're serving the rest of the world and earning foreign exchange. So while we think of trust, it's important for consumers to first recognize that we're not profiteering, that we need to make profits to be sustainable, to reinvest, into quality healthcare, to upgrading our medical technology, to paying our doctors well. And this is mostly about sustainability, so that people understand that we are focused on delivering world-class clinical outcomes, and we're doing so at 1/10 of the international cost. It's time that people start moving the conversation to from how expensive we are to how efficiently we're doing it at 1/10 of the cost. I think they need to move, change the level of conversation. And I hope that conferences like you and the media and Ireena will help us do so.
Thank you. And Ireena, I remember how you stressed the importance of value-based financing, but you also said in a previous conversation I had the privilege to have with you that it's important to see a partnership around data flows. I mean, in a sense, if data is not shared, then a nation can only have a very partial view of its disease profile. And in the current pandemic, I mean, it seems to me a sort of very difficult situation to sustain. How do you see this?
I think the underlying issue is one of trust between government and private, trust between patient and doctor, trust between doctor and the healthcare provider. And a lot of these are fault lines in India today, which lead to second order consequences that are not healthy. The government talks about price controls. The poor doctors get beaten up. The patient wonders if he's being fleeced. So nobody is happy, right? And Suneeta thinks they're not making enough money. True. So I think if in this context, to me, data flow is one element of bringing transparency, which will do two things. A, it will help India focus her efforts and also leapfrog. I mean, there's no reason why the universal health system of India cannot, for example, move to care-based pricing. I'm not an expert on this at all. I don't even know if it's possible, but why should we go through all the same steps that other countries have gone through and not bring incentives which are about keeping people healthy rather than making them healthy when they fall sick? And you can't do that unless you have shared and aligned dreams, shared and aligned data, so that the conversation is not based on opinion but is based on facts, and shared and aligned incentives. So to me, the data piece is a piece of a what's very cool nowadays, right? An ecosystem play. Everybody talks about an ecosystem. We have an ecosystem, and our ecosystem is broken into pieces. It's time to put it all back together and put the patient in the middle of it, rather than have each part of the ecosystem bashing up the other part of the ecosystem. Doesn't help anybody.
Thank you, Ireena. And I think it's a very wise view. We should basically, for the health system, try to have this comprehensive view. And I mean, data flow is certainly one element. And we heard in the digital session that the government is indeed taking the sort of very great vision towards data sharing and digital, coherent digital platforms, but that's very difficult with a fragmented health system. So a complex topic, but nevertheless.
Yeah, and what, sorry to interrupt you. I just want to make sure that the data flow is not just the transactional data or data about disease. It should be about cure, right? It should be about shared value unlock and how it is shared. So I wish the data conversation moves from EHR and capturing data and hotspots, all of which we need to do, to the real insights that good data can provide, so that the right level of investment in the right kind of infrastructure done by the right people with the right level of shared risk happens, right? So I think we need to frame the data conversation to make it go beyond EHR to sharing insights, information, and most importantly, risk. Healthcare is a risky business. We need to recognize that.
Thank you very much. Yes, indeed. And when I hear this, I think it's an excellent sort of segue to have a wrap up of of this day. We've heard so many rich informations today. And I'm now looking to Aishwarya if that's the right time for me to move directly into this wrap-up.
Most certainly, ma'am. The stage is all yours. I would request you to make wrap-up comments for day one of this session 3.
Thanks,
So I
Karine.
thank, first of all, yes, Ireena and Suneeta, thanks a lot for this exchange, which I would have liked to have in person, very frankly.
One day, don't
Hopefully
worry.
soon.
Happily one day.
So I will try to wrap up. It's a very difficult task and try to extract key messages. But also, if you allow me, a few quotes from speakers, which particularly resonated with me. I will try to be succinct because we had wrap-ups of different sessions. What was really striking for me was to hear the sort of real story and experiences from health companies, how they basically suffer through this crisis. And there was a quote this morning about 60 to 70% drop in occupancy rates and all the consequences across the value chain. But also we heard many stories of how companies showed resilience to provide their services and equipment, like, for example, the story of the Siemens Healthineers. So to repeat something that my colleague Rana Karaje has said and presented earlier this morning, IFC has put in place an $8 billion facility to give our clients some breathing room. And this program has been largely utilized in Asia and globally. And we also more recently put together a global health platform, $4 billion program to support health companies fighting the effects of COVID-19, and that's anywhere in the world. And talking about financing, we had a number of speakers talk about the importance of pooling public health funds. And I'm here quoting Mr. Mokim and Langenbrunner. And also of reforming the way health services are financed to reach universal health coverage. My colleague Owen Smith stressed the importance of increasing public spending on health overall. And Suneeta has just stressed that 4% of the budget has been spent on healthcare. But also Owen talked about the importance of transitioning from out-of-pocket payments to government and health financing through insurance, which has picked up and is picking up in India right now, and working around the concept of value-based financing, but also learning from foreign models which worked in similar contexts. And Ireena, stressed the importance of leapfrogging and looking at failures and successes elsewhere. And let me mention, perhaps, if I may, one quote from Mr. Khanna, who was himself quoting Mr. Varde this morning, about the importance of increasing consumption in healthcare. Yes, but only as needed. And that's the quote. It should form a guiding principle for us all. Several panels, and also we did on our Fireside Chat, mentioned the trust deficit between public and private sectors, and the fact that this crisis should trigger ambitious and win-win partnerships. So I don't know personally any country which managed to reach universal health coverage without public-private collaboration and a mixed delivery of healthcare services. And notably, a number of speakers recommended to do that, to move from pure cost leadership to the role of value adders in India in order to boost investments in healthcare. And Suneeta stressed basically the experience of the IT industry, which has known for a number of decades a fantastic success thanks to the support received overall. One panel discussed public-private partnerships, and one mention was around hospital infrastructure and the deficit in beds to be complemented. through this tool. And in India, there were many attempts, but very few successes. And the World Bank and IFC know this experience firsthand, as we advised on several PPPs, such as the Medanta Hospital in Patna, which just got commissioned successfully. So panelists stressed many issues around PPPs, that past PPPs did not provide expected returns, and therefore companies are sort of resent repeating the experience. Now, the government has just issued a few months back a new viability gap funding scheme, which aims to provide ambitious public financial support to such high social impact projects, which otherwise would lead low returns. And it seemed to, look like what Mexico has done for health projects, but also in other sectors, as explained by Mr. Forte. So this new VGF scheme needs to be tested and piloted with very high profile projects, demonstrate successes, and also hopefully attract equally high profile healthcare providers who will go for these partnerships and strong collaboration with the public sector on the right basis with the right contracts. One word about senior care. The panel led by Mr. Mahajan triggered additional thinking from my perspective on how to finance the silver economy. And also he stressed the importance of attracting larger cooperation in this growing area of needs. That, I found very, very insightful. And finally, on digital care, if I may, Dr. Harsh Mahajan put it, very rightly. Another quote I'd like to make, that if any country can lead in leapfrog innovation there, that's India. So, we look up to India to sort of launch a wave of innovations in healthcare that the world can replicate. It's been very inspiring for me to hear Dr. Praveen Gedam about the vision of the National Health Authority and explain the complexity of providing coherent digital solutions across the fragmented health system. And equally inspiring, and this is what I would sort of end with, to learn about digital solutions that were concretely implemented by the providers across the country, such as what we heard from Suneeta about the Apollo 24/7 and the home-based COVID monitoring being just two examples. Thank you very much.
Thanks very much indeed, ma'am. Thank you. That was a very, very enlightening wrap-up, in fact, and a sum-up that helps us take away so much from the first day. So thank you for sharing the key learnings of day one. And with that, now it is my privilege, ladies and gentlemen, to call back onto the dais Dr. Shravan Subramanyam, the Treasurer of NATHEALTH and MD Wipro GE Healthcare, to render his concluding remarks for day one of the NATHEALTH Annual Summit. Sir.
Thank you so much, Aishwarya. And for those who missed the bulk of the session, if you were even there for the last 10 minutes when Karine was delivering such a fantastic wrap-up and summary of all the sessions, I think that was extremely instructive and useful. Of course, NATHEALTH will make some of this content available in different formats shortly, so watch this space. It's some amazing material. This last session in particular, the last couple of hours, we were talking about digital and how it ties the thread between screening and diagnostics and therapeutics and, of course, prevention now if we're looking at vaccination. But while we think of digital often as a technology, the last session also taught us, by the way, if you could get my slide up, please, that'll be great while I'm closing. The last session also taught us that there are so many aspects to digital, and that could include financing, as we heard just in the previous session, technology, we had some great examples, changes in clinical practice, Anupam Sabal and some few other speakers were talking about that, changes in workflow. And of course, we had Dr. Ishwara Reddy talking about government intervention and policy. The last thought, though, on this, which I really appreciate the most, again, Karine brought it up, and it came up more than once, and this was around trust. And there is a trust deficit in the system. we all work for one system or the other, and having forums like this, I think, increases the transparency, increases the opportunity for us to communicate, to learn, to share, and then eventually be able to collaborate to make India stronger in healthcare. I don't know if you're able to get my slide up, but I just wanted to leave you with some thoughts.
Just a minute, we are getting that up.
No problem. I just wanted to leave you with some thoughts on, one of the speakers was talking about the post-COVID world. I don't know if we'll ever have a post-COVID world in that sense, because we're just going to learn to coexist with it and find ways to work with it. But specifically, considering the last session had a lot of talk about digital, I see that telehealth, telemedicine is going to be the new standard of care. I think at last year's session, if not the previous year's session, Dr. Pratap Reddy was talking about how telehealth was going to change things 15 years ago. It's here to stay, and it's going to be exponential in the coming years. We spoke about financing, and we had some good examples where we were talking about how healthcare is going to be financed, and we need to have creative models, different models, again, collaborative models with potential for consolidation. Healthcare service delivery, we need to think of the patient as the consumer and think of outpatient as the new inpatient, and what we are going to do to transform the customer experience or the consumer experience as it regards to patients, and retail clinics might very well be in the picture. AI is a term that has been bandied about for quite a while. Being in the healthcare, in the medtech industry, we are seeing the real impact that it can have on people, on patients, on communities. Also, we spoke about partnerships. So it's not just going to be medtech to medtech, it will be medtech to pharma to service provider. And of course, when it comes to retail, how that's going to touch the patients and the consumers as well. As we're grappling through all of these changes, we also have privacy laws, we have cybersecurity laws. Telehealth is expanding, but what does that mean for data transparency, data sharing, and eventually data interoperability and portability? These are all issues that we have been grappling with over the last few years, but suddenly its importance has become exponential and very critical, and we need to do a lot to change. And I think our government has stepped in, our government has offered a view, has invited views where we can collaborate, we can debate, deliberate, and come up with various regulatory opportunities, whether it's reimbursement, whether it's data management, whether it's certification. So there are so many changes going on, and with change comes opportunity. So I invite you to consider this as an opportunity, this inflection point. Someone mentioned, let's not waste a crisis. Think about all the changes that are likely to persist in the immediate post-COVID and eventual world. I've just shared a few points for your consideration, but I'm sure our speakers, amazing speakers throughout the day, they provided us with plenty of information, plenty of resources, which will be made available to you through NATHEALTH. I thank all the speakers, the moderators, the officials from the government, and the experts who have been so generous with their time to be a part of this session. And most of all, thank you, audience. And Aishwarya, with 1 minute to spare, back to you.
Thank you very much, sir. I have to say thank you, Dr. Subramanyam, for that very stellar introduction to session 3 today, the digital health and medtech session that you introduced, and an equally illuminating conclusion for the entire day. So thank you so much for that once again. Now, ladies and gentlemen, it's time for me to really bring this day to a close. And I would also like to express my deepest gratitude to all the dignitaries who added immense value to the first day of the 7th NATHEALTH Annual Summit. Once again, I'd like to inform all of you that our session sponsor is Health and MedTech. We will take a look at the audiovisual of Healthium.
We are Healthium, a leading global player in medical devices, creating access to precision medtech for every patient globally. Our passion for R&D, stringent quality control, and sharp focus on next-generation technology has resulted in 52 patents in India and the U.S. and enabled us to get U.S. FDA, CE, and ISO approvals. We are the largest independent manufacturer of surgical suture needles in the world. the first in India to manufacture bioabsorbable implants and contribute to 50% of India's suture exports. Across the globe, surgeons use a Healthium product in 1 in 6 surgeries to ensure superior surgical outcomes. We are Healthium.
Sponsor Healthium. And ladies and gentlemen, with that, let me take the opportunity of quickly thanking all our sponsors, our gold sponsors, Apollo, Medtronic, Mahajan Imaging. Thank you very much. Of course, our session sponsor, as you can see, was Healthium. This particular session, Digital Health and MedTech, was partnered by Healthium MedTech. Gold sponsors, Apollo, Medtronic, Mahajan Imaging. Silver sponsors for the event, Fortis, Johnson & Johnson, Polymed, Siemens Healthineers. Bronze sponsors, Terumo and PD Hinduja Hospital. And our session sponsors, Healthium, Century Super Specialty Hospital, and Capsico. I'd like to inform you all once again, ladies and gentlemen, about the Green Initiative by NATHEALTH with regards to environment conservation. We shall be planting about 10 saplings per speaker featured in the summit, which will make an impressive number of about 750 saplings being planted at the end of the summit. We also have a hashtag for the event, and I would request you once again to spread the messages from the NATHEALTH Annual Summit, this 7th edition, far and wide across all social media platforms using our hashtag NATHEALTH Annual Summit.